The number of people who have recovered from COVID-19 in India has overtaken the number of active cases for the first time. And that's despite the country adding close to 10,000 new cases daily for over a week now. About 75,000 cases have been recorded since the beginning of June, taking India's tally past 276,000. Just over half this number of cases have been discharged. The states bearing the brunt of the cases are Maharashtra, Delhi and Tamil Nadu. With more than 51,000 cases, Maharashtra's capital of Mumbai now has more cases than Wuhan at its peak. Neha Punya tells us more.
After 2.5 months of businesses being shut, of people staying locked up inside their houses, and of the streets of India's capital looking eerily silent, this is the new normal. We're seeing far many more cars on the roads, more people stepping outside but with their masks on as malls, restaurants, hotels and even places of worship open up. But increasingly, many Indian citizens are asking whether the cost of reopening the economy is too steep, given that India has recorded nearly 10,000 cases daily for 8 days in a row. Securities research firm Nomura says India is one among 15 countries where the lifting of the lockdown measures could be catastrophic. It says India falls in the danger zone along with several other low-income countries where lifting the lockdown could lead to a big enough surge in cases that shutting down the country once again will become necessary, and many residents say they are worried.
Restrictions, reimposition can be looked at it if it gets out of hand. That's where it is heading right now.
हाँ जी मैम, बिल्कुल लग रहा है इधर जैसे मतलब बढ़ोतरी हो रही है कोरोना में, हर लोग अवेयर नहीं, मतलब यूँ ही घूमते बगैर मास्क के, मतलब बहुत डरावना महसूस होता है कहीं हमारा नहीं हो जाए.
Now, the government disagrees. It says there's absolutely no need to panic. In fact, on Wednesday, India recorded more recoveries than new cases, and the government says that that is an encouraging sign. But the situation in Tamil Nadu, which has the country's second biggest outbreak, is worrying. It recorded more than 1,600 cases in the last 24 hours, the biggest daily jump so far. Similarly, in Delhi, cases increased by 30% in 1 week. The government says by July end, the capital will have more than 500,000 cases and will need at least 80,000 beds. Its current capacity is less than 9,000. The Delhi government has now started requisitioning private hospitals and hotels on a war footing, it says, but many residents have expressed anger. They say the wait to get admitted for a COVID-19 positive test to a hospital is a long one. Many others saying that they're finding it increasingly difficult to get themselves tested and are wondering why the government felt the need to lift lockdown measures when its health capacity had clearly not been expanded. Neha Punya, CNA, New Delhi.